Hello, everyone. We're going to jump into our second session of the day. We see everybody popping back in. All right, we'll get started real quick. Awesome. All right, so welcome back again. We hope you all had a very relaxing break as we jump into our second session of the Board of Directors workshops, Organize, Preparing Your Organization's Soil for an Operational Policy Harvest. Yeah, so here's a look at today's agenda. We will end promptly at 4:00 p.m. Eastern Standard Time, 1 p.m. Pacific, and move into the final 10-minute break for today. And we will go into our housekeeping again. Before we get started, here's a few things to keep in mind for the activity that we're going to do. For the interactive participation during the activity, you will use emojis in your chat box to respond. And you can do that by opening the chat box and make sure your chat box setting reads to everyone, and then open by clicking the smiley face to search for your emoji. And you can type in the search bar the name of the emoji that you're looking for just to make it an easier time. All right. And if you have trouble accessing any of these features, please message our NCUIH staff on board and we will assist you in doing so. And now we would like to introduce our speaker, Dr. Kimberly Fowler. So Dr. Fowler has been employed at NCUIH since 2011 and is the current Vice President of the Technical Assistance and Research Center. She received her PhD from Yale University and Bachelor's in Science from Tennessee State University. At NCUIH, she has led the development of various projects focused on urban Indian organization capacity building and sustainability to support operational and programmatic growth, as well as supporting research centered on urban Indian health sector. So welcome, Dr. Fowler, and let's welcome Dr. Fowler by placing a heart emoji in the chat box or using a heart reaction.
Thank you so much, Divya, for that introduction. I appreciate it. I'm so happy to be able to share with you all today and really just have a hopefully an active and engaging conversation around policies and procedures as it relates to the board of directors. So for today, our objectives are to develop a multidisciplinary policy review timeline that allows for proactive updates, approvals, and/or elimination. Secondly, to implement a comprehensive policy review approach that is inclusive of AAAHC, HRSA, OUIHP, clinical, operational, and financial regulations and requirements. And lastly, we're hoping to be able to identify ways to combat policy fatigue through strategic front-loading and change forecasting. Next slide, please. So to get us started, I just wanted to have us really get to know each other and who's in the room. There are some emoji categories as are listed here, and we'd love to understand what type of facility you're coming from. So if in the chat box, you could place either a watermelon for a full ambulatory program, a lemon for a limited ambulatory program, a strawberry for a residential treatment center, an orange for an outreach and referral, or some grapes for if you are part of a different other type of facility. And please specify what that is. And feel free to type that into the chat box as well. Thank you so much. I just love seeing who's all in the room and where you're coming from. So we have an outreach and referral. We have a full ambulatory program. And we have someone coming from another type. Love to hear what that other facility is if you have a moment to place that in the chat too as well. And you can just continue to place those in the chat. Next slide, please. In addition to understanding who's in the room and what type of facility you have, seeing that this presentation is really going to help lift you up in the way that your regulation oversight is put in place, it'd also be helpful to understand your facility oversight agency. So once again, as denoted on the slides, there are different emoji icons related to the different regulatory bodies that we are aware of most urban Indian organizations are a part of. But of course, there's also an other category, which is a nice donut, chocolate donut at that. And if you wouldn't mind listing who that regulation agency is, or a snow cone, if you're just not sure. I think this is also a great opportunity for you to understand who all is in the room and take note for any future networking opportunities too. So, and I love the looking glass there. I'm assuming that that might just be related to the CARF, you couldn't find the egg itself. So I get it. Thank you for sharing. And then lastly, we have one other activity in understanding and getting to know your peers. This one is to understand if you know whether you consistently update your policy, if there's a consistent policy review process in place at your organization. And you can type in the word tie, which actually equals the yes. There's a robot's head that equals no. And in honor of fall, there's a pumpkin for if you don't know if there's a consistent policy review process. So thank you all. It looks like there's quite a few that have a consistent policy review process in place, and so that's great to hear. And if you don't know, then these are information and strategies that you can take back to incorporate and share with others. Next slide, please. Thank you. So in thinking about policies and procedures, it is a great way to think of it, that policies are an element of growth and they must be tended to with regular maintenance and harvesting, just like in harvesting corn, and so just like these seeds, they really are the foundational needs of your organization and allowing you to continue to grow. But also as a board of director, you play that role in ensuring that the soil stays rich for these seeds, that it remains healthy, and that it mitigates risk through regular policy review when thinking about those policies and procedures. And so they're definitely important in making sure that your patients and your staff are safe. And then also even understanding what your goals and objectives are in order to achieve those. And as I mentioned, mitigating risk is very important. We also know that as part of being accredited by the regulatory bodies, they are required from those agencies as well, having those policies and procedures in place, having them updated, and having the ability for the board of directors to review those and sign off on those as something that is approved. These policies and procedures also hold your staff accountable, ensuring that they know what should and should not be pursued at your organization. And lastly, building a strong organizational culture of safety, quality, improvement, and community is important for these policies and procedures. Next slide, please. So I want to note that the governing body of a health center is generally responsible for establishing and or approving policies that govern health center operations, while the health center staff is generally responsible for implementing and ensuring adherence to these policies, including through operating procedures. And this is important because there are, and I understand I jumped to the bottom of the slide, but there are important processes to understand what is in and out of scope as part of your role as a board of director, even when it comes to these policies and procedures. And so kind of mitigating some micromanaging that could occur that's not in the realm of a board of directors themselves. But I do think that boards of directors are important in this policy and procedure role setting because you are in place and responsible for the organization in establishing policies for the organization, but also in approving those that may be supportive of the work of the staff itself. You are able to provide oversight, insight, and foresight as you work through these policies and procedures, as well as understanding the orderly conduct of the organization and what's necessary to do so by creating those policies and procedures. And I just wanted to note as a quick HRSA note in relation to board authority, the governing board of a health center operated by Indian tribes, tribal organizations, tribal groups, or Indian organizations under the Indian Self-Determination Act, or urban Indian organizations under the Indian Healthcare Improvement Act are actually exempt from some of the specific board authority requirements that are discussed in the Public Health Safety Act, Public Health Service Act. So that's just something to note that even within the HRSA guidelines of being a HRSA facility, there are some practices in there that you are exempt from as a governing board. So it is important to take a look at that HRSA handbook to be clear in understanding what those are. Board members should also follow the list of the Office of Urban Indian Health Program governance requirements for board authority indicators as well. And so that is just an additional, I wouldn't necessarily call it a regulatory body, but in the organization that a lot of your programs are funded through. So why do we need to review policies? Well, in essence, a lot of time policies are set and we want you to not be in the mode of setting it and forgetting it. And if it's not looked at, if it's not reviewed, then it probably isn't that effective, because years later or time later, that policy could be out of date. It's not following the appropriate policy that is needed for a regulatory body. And yes, organizations should definitely have a policy and procedure updating policy in place. That was a mouthful, but just understanding that even your policy review should have a policy in place for it. And that does help streamline and standardize organization workflows that are followed by the staff as well as the board of directors. This gives opportunity for the growth of your organization or company with these policies being reviewed, as well as the continuous improvement in patient care, which we know that is at the heart of the work that we do, and making sure that our patients are served in a culturally appropriate way. There's also the regulatory agencies that in some ways mandate that there is a review process in place and do look to see when the last update of your policies have occurred. And then for external impacts that can impede operations, as we're in this COVID-19 pandemic, it's definitely an evidence of how external factors can play a role in our policies. Even the California wildfires that are occurring, facility flooding that some have experienced at some of the UIOs. It really is important to have exposure plans, infection control plans, patient safety plans that are necessary in order to forecast and anticipate how your organization will actually prepare and think about future challenges that could come about. Next slide, please. So when do we need to review our policies? And so there, some flow into the why when we think about the when. But as you think about different regulatory changes that come about that may come through law, there may be new regulatory laws and law updates that are important to include in your policies. One important one most recently was the telehealth loosening of some of those policies, and that may have transpired to you needing to update, if you were providing telehealth, updating those policies. Changes in your organization. We know that as an organization grows, your organization chart may be structured differently. So ensuring that that chart within your manual and your forms and your policies is the most accurate one. You also are able to begin to provide new services that need to be created policies for as well. There could be public health impacts, as we just talked about with COVID-19 or other epidemics. And then, of course, there are incident occurrences that kind of push us towards new policies when you think about if there are patient complaints or if there's adverse events that may occur as well. Next slide, please. So in continuing and talking about when to review our policies, one key topic is that it should be regularly and proactively. So I just want to see in the audience, for those that actually said yes, in other words, you put a tie in the chat box to having regular, consistent policy reviews. What time frame are you using for that review? Is it annual? Is it biannual? And just trying to get an understanding of those in the room that are consistently updating or reviewing their processes. What's that time frame that you're using? Biannual, yes. Thank you for letting everyone understand that. And it's interesting because depending on the policy, it may require a shorter or longer term period of review. Yes, exactly. That Mr. Loera wrote that depending on the policy, it can be 1 or 2 years, but most are annual review. And I apologize if I did not pronounce your name correctly, but thank you for sharing that information. So yes, regularly and proactively is what is most helpful. It's super helpful, and that this could also be a great time to set what you feel is important for those timeframes. Here on the screen, you can see here that this is an example of a AAAHC manual, and it actually documents and shares the timelines that should be used for certain policies. So it's actually really nice in supporting you on reviewing in a timely way, and that they have a checklist and understanding if something has been reviewed on an annual basis, or what's needed for an annual basis review, I should say. And it identifies that in a way that you could, as I mentioned, with that checklist box. Regulatory agencies are written into the standards, as AAAHC also does. And your board of directors subcommittees should remain mindful of policies that require annual review. These usually also lead into other documents that require board of director reviews, such as an annual budget, your annual needs assessment, even your annual business or operational plan update. And so you can actually kind of think it through once a year to bring them all together to review. But another great tip is to kind of spread those out in a way. And we'll talk a little bit more about that shortly, how that can be done. But scheduling the review is definitely the starting point of being able to set that time aside for it. Next slide, please. So this table actually identifies which AAAHC, IHS, and HRSA policies require an annual review. You can see here in the first column, it shares what the policies are, and then as identified by the X mark, you can see where those lie at for the different regulatory bodies. Please note that this is not an inclusive of all policies, and there are some non-policy documents that might require annual review as well. Ones that we talked about, like for instance, with your budgets, that should be reviewed as well. The list is also not comprehensive, but it does allow you as an urban interorganization and as a team within your board of directors to add in other policies that you might need to focus on. So the OE3Y actually denotes once every 3 years, as denoted by HRSA. You can see that they have a kind of a 3-year timeline of some of those policies that are required. And we're hoping that this template that you see here will be shared with you following the full board of directors series. So that will be coming out. And just looking at this, just a quick audience question, based on the next review date, which is that last column, which policies should be reviewed at your October board of directors meeting? And feel free to write that in the chat, just a little short quiz as we're moving along. Just thinking about what for the October board of director meeting should be covered in relation to the policies themselves. And I'll give you a hint, anything post October 1st, 2021 should probably not be included at this point. So we can see here that there are the rights of patients, which is that first policy. The next review date is September 1st, 2021. But in case that hasn't been done, of course, at the October meeting, we would want to bring that forth. The appointment and reappointment, the risk management, and the annual training are policies that should be brought forth in this scenario for an October review. Next slide, please. So let's talk about how to identify policies to review. Actually asking you all, how do you all identify policies? If you wouldn't mind also writing that in the chat. And feel free to open your mics and share verbally if you are comfortable to do so. We'd love to hear your feedback as well in that way. Just want to ensure that they're able to do that. Justine, is that true? Okay, awesome, thank you. So once again, the question is just asking, how do you all identify policies that need to be reviewed? And unfortunately, I can't see if anyone's typing, but just continue to type one and we'll just flow right through, and I'll acknowledge that once that comes through. So I would say that one of the ways in which you can identify your policies, or one of the most common factors, are listed here in some ways. So you want to look for if something is outdated, if there is a newly added equipment or service, and if there are organizational update factors that would lend itself to a policy review. And then of course, we talked about the regulatory agencies and their checklist and what their requirements are. So I wanted to draw your attention to this slide and the different images that are listed here, because sometimes this gets missed when you add in new equipment to your organization. But what's listed here are the table of contents from the HRSA guidelines, the AAAHC requirements, and the Office of Urban Indian Health guidelines for their site reviews. And so I think it's important to just make sure that you look at each of these, or as well as any other regulatory body that you're working with, look at their checklist, look at their site review requirements in order to ensure that you're identifying what policies might be needed for them specifically to review, because I think that those would rise to the top in order to maintain your accreditation. It's also helpful to look at the manuals and standards and handbooks from those organizations as thinking about a cheat sheet. And interestingly, some of the regulatory bodies actually have an open book test for your site visit. So you actually can have the manual open as you're doing the site visit to kind of identify those things. And hopefully that would have been done in advance, but at least it gives you another opportunity to identify those. So what can be a great tool for the board of directors quality committee is that is to know what questions to ask and how the organization should meet compliance for policies within the board authority scope. So it is important also not only that your clinical staff and even your CEO or executive directors have this information, but the board members should as well, so that they understand what should be in compliance and how to ask those questions to ensure that they are being met. And just speaking from what's stated in the chat, for the policy review, we have ours on a rolling schedule so that we don't have to review them all at once. Each one is reviewed at the same time each year. Oh, that's a very good strategy. And that way you know what's coming up. You're even forecasting and understanding when that review needs to happen. So thank you for providing that feedback to us. Next slide, please. So the next step is actually selecting your policy review team. And as a board member, you may think, well, I don't know if I would truly need to be a part of that. Because if you think about it, as a board member, you may receive the final product of a policy to review. But I think it's important to also remember that it's the whole organization that's involved in this, including the board members. The process should be inclusive of those not only carrying out the procedure, but also those that are knowledgeable of compliance rules and developing them. And so I think that every board member, if there's a committee that is part of the review, could lend themselves to providing that additional background to share with those quality committee review teams. So it really is everyone. We also know that group policies, having group policies by functionality helps in understanding what's needed as well. And so if your review team is for instance, reviewing your dental policies, if you have those once a year, then definitely the dental team should have its own quality policy review team. If it's financial, if it's HR, but definitely thinking about how you can group those policies in a way so that you have the correct people in the room reviewing those at that time. I think it's also important that your organization, if you haven't done so yet, use a naming convention for your policies. Naming conventions can help others to quickly identify what a policy speaks to without having to scroll row after row of file names, especially knowing that you could have, 200 to, 500 different policies that might be in place at your organization. And so trying to quickly find those and identify what's needed to be reviewed could be helpful with a standardized system. Some policies might be cross-functional, but you can always use your handbooks to determine the primary function. I would lastly say that selecting a policy captain for the grouping is also important. And that might just be your department directors, perhaps could be over that different grouping. But that policy group lead would have the most information about how a policy convention name could be utilized for them. And it also helps others, as well as the board of director members, to identify who the champions are on that policy and perhaps coordinate any policy review meetings with them if needed. Also, your board of director committees can use the groupings to identify which groups fall under your committee's scope if the BOD committee has separate groupings as well. So it really is about keeping in mind your role, how to ensure the organization is in compliance, and providing quality care. So let's take a look at a few policy management examples. And we started to talk about that a little bit in sharing some of those tools. But as you can see on your screen here, there could be several work groups that are involved in your policy review process, depending on the groupings. So your human resources could have its own quality review, which would include your HR director and the HR coordinator. And the asterisk actually denotes the possible policy lead. You may identify someone else that might be important to be that champion for that work group. But you can see a variety of different areas that are probably within your organizations that could have work groups to be that could review policies, excuse me. Usually the director or the C-suite staff is that captain. And usually that's just because they could probably remove barriers given the time-sensitive nature of policy reviewing. But it's also important that you create a shared responsibility for the team and the organization as a whole. So being able to also bring in other members of the organization along with those directors or C-suite staff is important. Next slide, please. So this is actually an example of a policy tracker, which is a way in which you can group those policies using the standardized names that you might have come up with. We'll get into policy software in just a moment, but this is a great place to start if you don't have a tracker in place, just using a Word or an Excel document that lays out the basic policy groupings. You can see here there's finance, there's clinical, there's medical records, and they're all indicated by that nomenclature that you would have determined. So in this case, the file naming such as finance is the FIN 001, or you could do FIN 0.1 that denotes each type or each policy, excuse me, or any other convention that you come up with. The important part is that you create a structured file naming system. A great tip also is that often the individual tracking the policy review often wants to build a tracker to their personal management style. However, an organization-wide tracker calls for a universal approach that's simple, replicable, and conveyable. So keeping this in mind and flexing when necessary to support your organization. So you can see here there's columns for the policy name itself, the date that it was approved, which regulatory body it relates to or is required for. The policy lead is also listed. And then of course, your next review date is indicated here. So you already are informed in a way that could create a policy calendar for reviewing. Next slide, please. Which brings us to the policy calendar. So all of the strategies we've shared thus far, which are identifying your policies to review, understanding when to review those policies, and determining who can help lead or contribute to those review, is known as front loading your work. You've positioned yourselves with the who, the what, the when, and the why, and we're now moving into the how. We know that policy burnout is very real, especially for board members. Even well-run organizations have a standing board of director policy review agenda item that allows for small amounts of policies to be reviewed at a time, similar to what Gerardo actually mentioned in the chat earlier. So in addition, efficient organizations allow for at least 3 to 4 week window for a board policy review versus 1 week, which oftentimes can be unrealistic. So you really want to make sure that you're ensuring that the board has the documents in advance to review, and that it's not something that they get the day of the meeting, knowing that they would not have had the time to really digest the information and bring forth any salient questions that they might have. A mitigation strategy after you front loaded your policies is to create a policy review calendar. So using this approach that can be seen on the screen, you can now forecast when the board committee might have more meetings, when a given period, or when your committee might need a break or get a break. So listed here is the quarter and the years over time. And then using that nomenclature that we described earlier, you can see your finance team, they actually don't have any policies to review into the second and third quarter of 2023. So in essence, they have a little bit of a break, if you will, in reviewing those. However, if you take a look at your executive committee or your administrative committee, quarter 4 of 2021 and quarter 1 of 2022 are actually approaching quickly, and they're going to need to spend their time in that space to actually review their policies. So hopefully this gives you a nice tool that can prevent burnout by spacing things out, but also being able to forecast when those would occur. Next slide, please. So we're almost coming to a close of time before our activity, but I did want to just talk through a little bit and hit on some of the policy proving that's happened this year, actually. If you think about all that has occurred in the world and in your communities, and why policies were so important in these past almost 2 years, some organizations quickly pulled out their exposure plans and began immediately moving toward following their procedures. Whereas other organizations who had not reviewed or actually even created their exposure plans really had to take some time to start over or start from scratch and even review those in order to ensure that the organization could continue running smoothly. So we know that this is a key factor in policy or in burnout in general for organizational staff. Some teams had to develop vaccine plans and draw up how they would test for COVID or administer COVID vaccines while keeping their patients and their staff safe. And that was a lot to be done. And I understand that those are new policies, but they're also affected some of your older policies as well. So it's almost like a kind of a twofold collision of needing updates for your past and your future at the same time. So where you want your organization to be is actually kind of in that former category of having those exposure plans in place. So you're ready with a plan and you're ready to execute. And as a board member, your role is actually to set that policy, and you're responsible for the organization's oversight, insight, and foresight. So it is important for you to keep in mind and keep at the front of some of your agenda items that policy review is needed. Next slide, please. And I'll go through this very quickly. This is just an example of a policy review process, but just thinking about the fact that you should use small targeted work groups as effective and efficient processes, rather than have one organizational committee updating all of the policies. The board members, as board members, you may or may not need to be included in the smaller work group, but the final product you receive should be that thorough, comprehensive, and knowledgeable review. And I will say that there are definitely some softwares out there that can support policy review. Some of those are actually, the names of those are Document Locator, Logic Gate, Converge Point, but there's also Microsoft products that you might be using currently that are helpful too as well, such as Excel, SharePoint, Smart Sheets, all of those different ones that are maybe free or lower cost than the actual policy software tools that are in place. Next slide, please. So I think I will skip this slide since we've talked a lot about policy burnout. And I'll just leave you with the fact that there really was a lot discussed in what I provided on policies and the review processes and how you can develop those. But we know that these are all achievable. It's something that you as a board member in some ways have signed up for in order to keep your organizations moving smoothly. It allows you to invest in your policy software, to create a policy tracker spreadsheet, to create a policy naming convention, develop a policy crosswalk, and implement a policy review calendar. And so keeping all of those things in mind, the outcome is to really think through how you can protect your soil. And so we want to move into an activity that can allow you to kind of share with each other on how you can do that in a way that you can think about innovative or creative ways that as an urban Indian organization board member, you could use within your own organization. So I wanted to start with asking the question, and feel free once again to write into the chat or open your mics. And if you wouldn't mind sharing about factors that contribute to policy overload, if there's someone that is able to share that, we greatly appreciate that. And just hearing from you coming from different facilities is important too as well. So once again, if you wouldn't mind sharing factors that contribute to policy overload as examples. And I'll just start with one example just to get our minds thinking. It could be that everyone is just too busy. And that is probably something that is probably at the top of the list in this moment. But what other factors contribute to policy overload or that you've encountered as you think through your policies? Right. Insufficient staffing. Oh, that's a great one. Thank you for sharing that. Definitely not having enough staff to work on this. And also, it's also mentioned high clinical caseloads and responsibility. Yes, those are great examples. And thank you for sharing those. And I'm sure that others can relate to them as well as contributing to policy overload. And then just moving into what are preventative factors for policy overload. We've actually shared some here today, and just continue to write in the chat. That helps everyone see your thoughts, so thank you. If there are any factors that prevent policy overload, we see in the chat that policies in high numbers are submitted to the board for immediate review. Yes. So if there isn't enough time, it's a little bit overwhelming to receive a stack of policies to review in one kind of setting, one agenda item. So thank you so much. And just as an example for factors that prevent policy overload, it could be not even knowing when the review dates of a policy are. we talked a little bit about that. So you're almost blindsided that, oh, wait, this policy now needs review, as an example. Are there others that you can think of? And again, these are factors that prevent policy overload. Last minute requests to review policies. Yes. So on the flip side of that, in trying to prevent that, it would be to definitely provide that information in advance, maybe even understanding that in your next meeting, you're going to review certain policies, and even providing those at the end of that meeting so that the next month or the next biannual or quarterly time in which the board meets, you'll be ready to actually provide your feedback on those. Another example would be ensuring your staff have the tools necessary to update and disseminate policy updates. So if there is a situation where, yes, your director might be over the review process, but the staff that is supporting them may not even know where to look for those policies, look for the policies in order to start that process. That could be a slight hindrance for getting things going, and it could delay the process. Okay, so we'll go to our next slide, our next food for thought. So based on all of these factors that you've mentioned, what strategies will you or have you implemented to prevent policy burnout? And I'd love to hear from anyone that might have been a tie, meaning that you did have consistent reviews, but definitely anyone in the room is open to share. And again, that's what strategies will you implement to prevent policy burnout, or what strategies have you implemented to prevent policy burnout? Because I do think that we didn't cover, the end all be all of all that's available and understanding what causes it. So would love to hear what you have shared as well. So Talarita, and I apologize if I am mispronouncing your name, but thank you for sharing. I states that I am hiring a program manager for the particular program that needs a policy overhaul. Yes. So sometimes it does take the additional workforce to help support some of the work at our organization. So having a program manager on board that could do that, that's a great idea, a great strategy, bringing in more hands to help support. And I don't know if there's others in the room that would want to share in essence, what are you taking away from the conversation today that might help at your organization to prevent policy burnout? What you'd like to implement as you move forward from today? Yes, Evie states that I like the idea of forecasting, encouraging department managers to align their policy submissions to board accordingly. Yes, that's a great one. I'm glad that you were able to hear and understand and take that away, that putting something in place to be able to forecast. And just a reminder that policy review calendar is a great opportunity for you to be able to do that too as well. Cal mentions that advance notice of policies to be reviewed prior to board of directors meeting. Yes, I'm happy that you were going to take that strategy on and move forward with that. Also, you have mentioned rolling policy process, so it is not all coming up at once. Yes, I think those are all great opportunities for you to ensure that there's not a big overhaul that needs to happen at once. So I think with that, I will close us out and see if there's any questions. I appreciate all of the engagement, all of your feedback. Thank you for listening to me and also sharing from your own experiences.
Yeah, please. I think we have a chat maybe. Yeah, no. So yeah, thank you so much, Dr. Kimberly. I think this is a great presentation. And, as we're closing out this session, please feel free to continue to post your questions in the chat or come off mute. And yeah, if you have any comments or anything that you'd like to share. But again, we would definitely like to thank you. So please show your heart emojis and reactions in the chat for Dr. Kimberly's presentation. And we thank you again for joining us for Organize, Preparing Your Organization Soil for an Operational Policy Harvest Session. Again, so we will, I guess we will go into a break early if no one has any questions. We will now take another 10-minute break. So I guess it'll be a 14-minute break now. So we will promptly start again at 4:10 p.m. Eastern Standard Time, 1:10 p.m. Pacific Standard Time, and we will begin our third and final session of the day. So we will see you back at 4:10 p.m. Thank you, everyone.
Thank you, Brenda, for sharing that. That's a key point there about there are instances where the boards do become more micromanaging, and it's definitely a difficult situation to be a part of. But it sounds like you have stuck it out, and hopefully you can share some of the information you heard today in trying to relieve some of that too as well.
Yeah, definitely. Thank you so much for sharing, Brenda. Awesome. Well, we were definitely going to our break. Feel free to mute and turn off cameras, and then we will be back at 4:10 p.m. Thank you again, Dr. Kimberly.
Thank you.